Hi, I'm Alexandra Cook, and welcome to my TED Talk. I'm a representative for NAMI Seattle, the National Alliance on Mental Illness, and this program I will tell you about today is an important step in fixing the mental health crisis Seattle is facing right now. NAMI Seattle, currently the only organization in Seattle working to fill the gaps in the local mental health system through peer-led education, referrals, and support. NAMI, or the National Alliance on Mental Health, is the largest grassroots mental health organization in the country. Our vision is a world where all those impacted by mental illness know they are not alone and are empowered to live a fulfilling life, and our current mission is to establish this vision in the youth suffering from mental illness in Seattle, Washington. Seattle has a large population of an estimated 700,000 people as of 2019. Their community does have a lack of diversity within their large population, with 69.5% of the population being white and only 7.9% being black, and the amount of people making up two or more races is only 1.5%. Although blacks represent the minority, the race statistics have changed greatly since 1960, dropping from 90% of the population being white to the current 69.5%. Seattle is a rather affluent city as well, with their median household income being an estimated $83,000 a year. Men make significantly more than women, with their median income being $72,000 a year, and versus women's median income being $52,000 a year. Health-wise, Seattle is doing really well compared to the rest of the country in multiple areas. For example, Seattle's rate of obesity is 6 people per 1,000, while 12.2% of adults in the U.S. are currently suffering from diabetes. Also, Seattle has a lower teen smoking rate than the national average. The percentage of teens smoking in Seattle is 6%, while the national average is 7.2%. Seattle also has a relatively low teen birth rate compared to the national average. There are about 3.6 teen births per 1,000 teens, and in the United States there are around 61,184 women aged 15 to 17 who will give birth yearly. Although Seattle excels compared to the national average in some areas, they are failing in others, including important health areas such as those suffering from mental illness. Seattle is failing in many areas. For example, they have a much lower graduation rate than the national average. Only around 76% of students are graduating from high school, while nationally 84% of students are graduating from high school. This is important because lack of education leads to many health disparities such as poverty, food insecurity, violence, and higher burdens of illness or injury. They also have much higher rates of cancer death, with 151.1 per 1,000 people with cancer eventually dying, while the national average is 163.5 per 100,000 people. And finally, to come back to the main topic we are focusing on, Seattle's rates of those suffering from mental illness are significantly higher than national rates. 4% of adults living in Seattle are experiencing severe psychological distress, while 4.2% of people nationally are just suffering from some form of mental illness. Another staggering statistic is 27% of youth aged 12 to 17 suffer from depression, while only 11% of youth nationally are suffering from depression. The state of Washington's rate of mental illness among adults is nearly 20%, a huge difference from the national average. The reason Seattle was chosen for an intervention was due to their staggering statistics regarding access to care, rates of mental illness, not having insurance, and lack of early intervention. As the highest rates of mental illness are among youth, using an intervention targeted towards those in the youth category is necessary in diminishing the rising rates of this age group suffering from mental illness and also not being able to receive care for the issues they are facing. Specifically, major depressive episodes, or MDE, are increasing among youth, and over 62% of them receive no treatment. There was also about a 1% in suicidal ideation among youth within the last year. The national average of youth with one past year of major depressive episode is 11%. The lowest is DC with 8.8%, and the highest being Oregon with 14.62%. Insurance coverage is another problem facing youth trying to receive mental health treatment. The national average of youth lacking health insurance is 7.9%, with the highest percentage being a sharp jump to 16% in Oklahoma. As mental illness rates continue to rise in the United States, the first of its kind research aims to develop an intervention that targets a portion of those suffering from mental illness. The intervention being discussed will target PTSD, or post-traumatic stress disorder, in children. PTSD can occur in any person that has experienced any sort of traumatic event such as natural disasters, a terrorism act, a serious accident, combat and rape, or any other form of personal assault. It is reported that 72% of Americans have experienced some sort of traumatic event, and 20% of those will go on to develop PTSD. Women are more likely to develop PTSD than men. For example, 1 out of every 9 women will develop PTSD in their lifetime. Just around 1 in 5 youth aged 13 to 18 experience some sort of severe mental illness at some point in their lives. Among this group of youth suffering from mental illness, 4% of youth under the age of 18 experience some sort of trauma that leads to them developing PTSD. When looking at symptoms of children that suffer from PTSD, they tend to show emotional, mental, or physical distress when they are placed in a situation which reminds them of the trauma they endured. They also may show symptoms like not being able to sleep, depression, losing interest in things they used to enjoy, and struggling to feel affection. PTSD is only diagnosed in children if the symptoms last for over a month and are negatively affecting that child's life and their ability to function. This intervention looks at the mental health of children that are exposed to violence. This research was conducted at 2 middle schools in Los Angeles, California, in a primarily Latino and disadvantaged community. This was the first randomized control study conducted on children on how psychological intervention helped children that have started to show post-traumatic stress disorder symptoms after being exposed to violence. The program coordinators received permission from the parents of the children and the children themselves on whether they wanted to self-report their level of exposure to clinicians. Clinicians then used Los Angeles Unified School District, or the LAUSD, to administer the self-report questionnaire to students. This intervention was conducted in the urban city of Los Angeles, California. The study included 769 6th grade students who were predominantly Latino but were English-speaking, divided into groups of 25 to 30. The students were allowed to participate in the study based on 4 different criteria. If they had substantial exposure to violence defined as being the victim or witness of violence involving a knife or gun, had symptoms of PTSD in the clinical range assessed using the 17-item Child PTSD Symptom Scale, had symptoms of PTSD related to exposure to violence that they were willing to discuss in a group or determined by their school-based mental health clinician, and did not appear too disruptive to participants in a group therapy intervention session in the opinions of their school-based mental health clinician. In the end, 126 students agreed to participate in the baseline questionnaire. 117 students took part in the 3-month follow-up, and 113 students took part in both the 3-month and 6-month follow-up on the original questionnaire. After the study had been conducted, it was found that 126 students that chose to participate in the baseline study had been exposed to extreme amounts of violence. This randomized control trial found that when schools' mental health specialists took early intervention action, it significantly lowered the rates of students reporting symptoms. The study conducted found that 126 students had experienced an average of 2.8 violence events and witnessed 4.9 violent events. The average child PTSD symptom scale was a 24.0, which indicated between moderate and severe symptoms of PTSD. When looking at those that responded to the 3-month follow-up, the students self-reported less symptoms of PTSD than those that were placed in the delayed response group. Students that underwent CBITS, Cognitive Behavior Intervention for Trauma in Schools, reported lower rates of symptoms than if they would have gone through any intervention at all. The study reports that 67% of students that underwent cognitive behavior intervention for trauma in schools reported lower rates of PTSD symptoms and also lower rates of depression. One of the 5 whys discussed was lack of access to care. As an example of this, 70% of local jail inmates are suffering from a mental illness and are receiving no care. Lack of access is a sub-cause of health inequalities, which include lack of access to care, lack of education, and poverty. Another sub-cause that is important, especially in Seattle, is low Medicaid reimbursement. This is causing large gaps in outpatient capacity for all mental health facilities. A major Medicaid provider in Seattle blamed the lack of rate increases for why patients struggle to get in with a mental health care provider or inability to receive care for a specific mental health issue. Mental health help is especially important in Seattle, Washington, because those aged 18 to 24 are 1.7 times more likely to be hospitalized for some sort of mental health condition. This intervention is a great fit for Seattle because they are not excelling in any form of providing or treating mental illness. According to Mental Health America, Washington ranked 28th in the country in terms of access to care. They are also one of the states with the highest prevalence of both adult and youth mental illness, coming in at 38th for adults and 35th for youth. Additionally, Seattle has a poverty rate of 11.5%, which is inequality that can lead to higher rates of mental illness. There are also over 9,000 foster kids currently in Washington, which is a 12% increase from 2012. The number of foster children is an important statistic when looking at how many of them suffer from PTSD. In a study conducted by Harvard Medical School, PTSD among adults who were in foster care as children were up to twice as high as U.S. war veterans. This data was collected from adults aged 20 to 33, all living in either Washington or Oregon. Although these are statistics from two different states, they're reflective of national trends. All this evidence of Seattle lacking any progression towards better mental health care is why this intervention needs to be implemented. When looking at PTSD in children, there are many community-specific members that will be needed to facilitate any kind of intervention. Luckily, Seattle is a large city with a plethora of options available to seek help from, which will be important as we try to get this program off the ground. To make this intervention possible, partnerships will need to be made with doctors, specifically psychiatrists that work with children, social workers, school corporations, and school therapists. One specific organization that will be used for this intervention is the organization I represent, the National Alliance on Mental Illness in Seattle. NAMI is currently the largest mental health organization in the United States, so they will be a huge help in starting the program throughout schools in Seattle. NAMI also provides counseling for those suffering from mental illness, counseling for families that have a loved one with a mental illness, advocacy groups, and presentations for those who suffer from mental illness and are trying to help others. In regards to how NAMI will benefit the intervention, they are able to send professionals and volunteers in to help with counseling, and they also have the ability to counsel the families of the children that have PTSD. Psychiatrists that specialize in children with mental illness, specifically PTSD, and school therapists will be essential in the success of this program. Clinicians or psychiatrists will be needed to correctly review the surveys filled out by students to determine whether they exhibit symptoms of PTSD. They will then be able to provide treatments such as cognitive behavioral therapy or medication. School counselors will be in charge of continuing counseling and early intervention once the program is over. Clinicians and counselors will also be referring students to University of Washington Harborview Medical Center. Harborview was chosen specifically because they have a center for sexual assault and traumatic stress help. Mental health is an increasing topic of discussion in this country as rates continue to rise. If we do not take action, the problem will only continue to get worse. I believe starting this type of intervention will make a change while children are still young and able to recover, will be beneficial in lowering rates of PTSD. I'm Alexandra Cook, and thank you for coming to my TED Talk.